Bismillahirrahmanirrahim. Ya Ali Madad, everybody. Welcome to the webinar today, which is entitled The Brain, Mind, and Healthy Aging, Early Preventive Steps to Reduce the Risk of Cognitive Decline. I know this title sounds rather complicated, but please bear with us. We will make the topic quite understandable for everyone. Before we continue, however, we would like to thank the hundreds of dedicated volunteers who have helped us develop all these webinars, and also to those volunteers who have been serving in so many different capacities for the benefit of our Jamaat. All right, well, welcome again. And my name is Dr. Shaheen Jaffer, and I am an internal medicine specialist in Vancouver and a professor at the University of British Columbia. Now, my main areas of practice are heart health, diabetes, and weight management. So, I'm really excited to be moderating today's session, and I look forward to learning about healthy aging and how it is connected to our brain and our intellect, our akal. And I'm delighted to have with us today two experts, Dr. Naheed Rajabali and Nadia Tajdin, and they will be joining us shortly, at which time I will be introducing them more formally. So the objectives of today's session are as follows. We hope to teach you skills to recognize and reduce the risk of developing neurocognitive or intellectual decline. And we'll do this by reviewing strategies to keep our brains aging in a healthy way, and provide you tips to cope and develop inner resilience if you were to experience neurocognitive decline. We will also discuss features unique to women's brain health and provide you resources such as puzzles and different books to learn more about this topic. And lastly, we want to have your active participation because we will have some brain quizzes, some brain challenges, and also a multiple choice question. Now, before we begin, we would like to advise you that any information that is provided in this webinar should not be considered medical advice and is not intended as a substitute for medical professional help, guidance, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding your medical care. So as I mentioned earlier, one of the objectives is to have your active participation. So here is a series of 5 points. Now, one of these points is actually correct. So we'll go through it, and then if you can keep in mind or just write it down, which one of these 5 you think is correct. All right, so let's go through it. So aging means you have poor health and or disability. Is this true or false? Number 2, memory loss as we age always results in the inability to function. There is nothing a person can do to reduce the risk of dementia. Healthy aging practices are only for those who are in their 60s and older. And lastly, people can still live well with a diagnosis of dementia. So I'll give you a few seconds. Just jot down which one of these 5 statements is correct. Now it gives me great pleasure and honor to introduce our experts. Dr. Naheed Rajabali is an internal medicine and geriatric specialist at the University of Alberta. He works primarily at Edmonton's Royal Alexandra Hospital's acute inpatient ward and the Geriatric Emergency Department Consult Service. He also delivers care at the Parkinson's Disease and Movement Disorders Program at the K Edmonton Clinic in collaboration with the Department of Neurology. Dr. Rajbeli enjoys teaching and has interests in research and clinical innovation in various areas, including surgery and critical care. He's currently a board member of the Multi-Generational Housing Community Center in Calgary. Welcome, Dr. Rajbeli. Our next expert is Nadia Tajdin. Nadia is a clinical educator at a healthcare startup called Gentronics, which creates interactive technology solutions for rehabilitation and senior care. She holds a master's degree in dementia studies from the University of Stirling in Scotland in the UK. And she's currently working on her second master's degree in public health there as well, plus working full-time. Nadia has previously been a rehabilitation assistant in care homes, and her research interests involve improving the quality of life of people with dementia and those who care for them. Last but not least, Nadia has just authored a children's book entitled Read Me a Story, just published last week. So congratulations and welcome, Nadia. And thank you both for sharing your insights and your thoughts, pun intended, and your expertise on the topic of healthy aging, brain health, and our intellect. So the floor is now yours.
Thank you, Shaheen, and hi, everyone. We will start today with neurocognition. Neurocognition, or our ukal or intellect, is our ability to think and reason, concentrate, remember things, process information, and learn, speak, and understand. So throughout this presentation, we'll be focusing on neurocognition when looking at healthy aging and the signs and symptoms and preventative measures of cognitive decline. Going to the next slide, we will start our discussion on healthy aging. So healthy aging is about creating the environments and opportunities that enable people to be and do what they value throughout their lives. Healthy aging, defined by the World Health Organization, is obtaining or maintaining physical, intellectual, emotional, social, vocational, and spiritual functioning at the best possible self-perceived level for aging adults. And it's never too early or too late to change habits and start good ones. No matter when you start, a healthy lifestyle can make a difference in how you feel and what you can do. Healthy aging is particularly important when we look at the population trends in Canada. The next slide represents the Canadian demographic trends. And here, the red line represents the proportion of people aged 0 to 14, and the blue line represents the proportion of people aged 65 and older. And as you can see in 2016, the share of people 65 plus exceeds the share of children with an increasing projected trend, which is a clear sign that Canada's population is aging at a faster pace. However, just because someone reaches the age of 65 does not automatically mean poor health, as there's no genetic switch at 65. And on the next slide, we see that 65 is somewhat of an arbitrary number. In reality, true age, which we call fitness level or frailty level, varies across numeric age. So Nahid, can you explain a little bit about the concept of true age?
Oh, yeah, that's a good question. Thanks, Nadia. So if you look at the next slide, when we're talking about true age, we're really alluding to, the fact that people are living longer and the fact that people with chronic disease are also living longer. And what that does is it makes the population we live in kind of mixed. It's a whole mixture of population, which is why we call it heterogeneous. So what you end up then having are individuals who are young and frail, or young and fit, or older and fit, and older and frail. So you can see on the photo, you have individuals who are, not that it means much, but perhaps in way better shape than I am, that are older. Then you have individuals like, Michael J. Fox, for example, who is afflicted with Parkinson's disease, which is a disease that impacts both the mind and it can impact the body as well, that are perhaps aging a lot faster despite being numerically young. And so when we look at the next slide, we can see just that in the population. So we can look at the people who are fit and frail across the age spectrum. So on the graph, you can see that there's a percentage population on the x-axis, and then on the y-axis, and on the x-axis you have the different age categories. And when we use frailty measures or measures of true age, and there's a few of these, but without going into detail, in both the red and green, no matter which way you measure, what these tools show us is that you have fit individuals in all the age categories, and you also have frail individuals across the categories. So what does this imply? Well, it implies a few things actually. One, that simply being frail is not a destiny of aging, that we can take some matters in our own hands and try to traject away from becoming frail. Not necessarily living till forever, but still having good reserves until death. The other thing it implies is that, well, at least that it doesn't make sense to have rules for people that are over 65 and people that are under 65. Rules for medical care and how we manage them. We should have a management strategy based on how much reserve somebody has, in addition to their disease process. And so we're doing just that these days in the medical world, where whether it's something like surgery, which is a double-edged sword, which can have risks and benefits, or things like heart failure management, where we apply these principles and try to tailor it based on people's reserves or what they can handle. And what we call fitness and frailty isn't just some terms that we use. There is a science behind this. So like many things, many disease processes, you have genetic factors that are involved, environmental factors, and these things impact little mechanisms or processes inside the cell that are associated with aging, like telomeres. You might hear some of those terms on television or whatever you read. And then those things then in turn get impacted by things that we have quite a bit of control over, like physical activity, nutrition, smoking, and alcohol intake or substance abuse or use, which then in turn impact other processes in the cell, like inflammation, can have too much of it or a disproportionate amount, or regulation of the endocrine system, another set of chemicals. And then it can impact things like your muscle strength, which of course we all need the muscle to be able to stand upright or lift things and function and so on. Now what's interesting is that some of these processes here are sort of some of the root causes of all other diseases, and other diseases can also further accelerate these processes. So whether it's heart disease, lung disease, cancers, dementia, depression, many of these have the same root causes with this inflammation and endocrine chemicals. And then this in turn adds to frailty, so reduced reserves, such that when you see a stressor, when you fall, when you go through surgery, when you're hit with a flu, etc., then in turn it creates more worse outcomes. You can be further disabled, you can get sick further. So this is some of the sort of, in short, the science behind fitness and frailty or reserves. And because people always say, well, what can we actually do? So Nadia.
Thank you, Nahid. I wanted to start with a quote from Sultan Muhammad Shah. And I quote, "I shall speak to my heirs of the vital importance of exercise. And since to take joy in your activities is one of the secrets of health, I should counsel them to play games," end quote. I want us to reflect on this quote. And as we move forward to the presentation, we will look at the importance of being active through exercise and activities to strategies that promote our health and well-being. Moving on to the next slide, we will see that there are many things we can do to help ourselves age well, including healthy food choices, staying socially connected, getting regular exercise, getting regular health screenings, being aware of changes in brain health, and keeping our brain active and challenged. And on the next slide, we will see that there are many things we can do to keep our brain mentally active. The brain is like a muscle. If you don't give it regular workouts, its functions will decline. These workouts or activities can include engaging in plenty of conversations, reading newspapers, magazines, and books, playing thinking games like Scrabble, cards, Trivial Pursuit, taking a course on subjects that interest you, cultivating new hobbies, or participating in activities you enjoy, like volunteering or art, learning a new language, doing crossword puzzles or word games, and playing games that challenge your intellect and memory, such as chess. So keeping your brain active is important. So throughout this presentation, I will be jumping in with various brain challenges, and I hope everyone will participate. But first, on the next slide, I wanted to speak a little bit about why brain challenges are important. So like your muscles, your brain improves with use. And studies have shown that exercising your brain increases cognitive reserve, which is your brain's resilience or ability to cope with stress and challenges. So exercises that challenge your brain can help with memory, language, spatial awareness, and strategy. And now it's time for our first brain challenge. Shaheen, this one is for you. Are you ready?
I guess I am. Do I have a choice?
No, no choice. Sorry. And I want everyone at home to participate as well. So, Shaheen, I want you to name 2 objects for every letter of your first name.
Okay. All right. Here we go. So S. So sun. That's easy. Just give me a few seconds here. Just trying to think what I've been doing lately. Okay. Soccer. How about soccer ball? Is that okay?
Yeah, of course.
That's an
Yes.
object. Yeah. Okay. H. Hat. That's easy. And I feel like this is Family Feud. Like the buzzer's going to go off.
No buzzer today, promise. No buzzer today.
Okay. H. Okay. Helicopter. Okay. Helicopter. A for apple. That's easy. A second A. I used to play this with my children. I'm going to say Antarctica. I mean, it's not an object.
no,
Is that
fine.
okay?
It's
Okay.
perfect.
All right. H heart. That's good. That's an easy one for me. H. Okay. Hotel. All right.
Yeah.
Hotel's okay. I'm just thinking what's around me. Ink. All right. How about ink? And then am I going to have trouble here? I think getting another I. Yeah, okay. I'm going to skip.
That's
Is that okay?
fine.
This
Yeah,
is my moderator's prerogative.
No worries.
It's not easy. My goodness. Okay. N. I've got nuts for N. And trying to think of another. Okay, how about Annette? Annette, how about that?
Perfect. You did
Yeah?
great. Thank you, Shaheen.
It's not
So-
easy.
Yeah, I know. So I hope everybody tried this and try it at home. Try it with your friends and family. And you can always increase the challenge by working up to 5 objects and trying to use different items each time you play. So thank you again, Shaheen, and thank you for everyone that played at home. We will have 2 more brain challenges coming up, so get ready for those. Nahid, maybe you can tell us a little bit more about how we can protect us against the decline of healthy aging, or of healthy aging.
Thank you. Oh, that was fun. Yeah, no, that's good. Well, you spoke about it, and I just spoke about it. But there are things that we can certainly do. So the most common things are things like exercise, modifying perhaps nutritional intake, and meditation. So if you look at what exercise does, it actually impacts the kinds of things we spoke of earlier, like the bad inflammation or too much, and the changes in endocrine system. So it actually reduces these processes or reverses them in a way that is protective towards not just dementia, but other chronic diseases. And if you happen to be afflicted by these diseases, it dampens the impact of them. Now, I would encourage you to do as much as you can. So if you can only walk, that's fine. But if you're able to go beyond that, there's evidence out there. It's become more and more evidence that's suggestive that the more you do with a bit more rigor, actually has more of an increased outcome or positive outcome. Now, first, there are some people who haven't exercised in a long time, or perhaps haven't at all. And so, what I would encourage or recommend is getting, a fitness trainer or a personal trainer to show you how to do things. Otherwise, it can be daunting. Now, during COVID, with the restrictions, it might be challenging to do that. So the best thing to do perhaps is to try to manage these things at home as best as you can. There are all sorts of online classes and other things that are out there to give it a try at the very least. The other things we can do are things like perhaps change our nutritional intake. Too much nutritional intake or too much taking in lots of food, sometimes even the kinds of food like too much sugars and processed foods, can also increase the types of things that increase aging, which then can lead to things like dementia and other chronic diseases. And so, what does this mean? Well, if you have learned how to cook from your mother or grandmother or dad or whoever, you may have to not change a whole lot. In fact, many of the meals that you might eat are already quite healthy, but you may need to change perhaps the portions that you take, or reduce the amount of sugars or processed foods that might be in them. There are resources out there, both at the federal level on federal websites or provincial websites on nutritional intake and diet, or you can even ask a nutritionist or a dietitian for some advice. And then lastly, meditation. There is now some emerging evidence that meditation is actually just as protective as the other two. And it impacts things at the cellular level with things that can that can cause increase in aging and chronic disease. So there's plenty of things that we can do. So moving on to the next slide. I think there's even more, right, Nadia?
Yeah, there's lots of things we can do. And we talked about this earlier. Participating in activities you enjoy supports healthy aging and brain health. So let's look at volunteering specifically here. And studies have shown that voluntary work offers physical, cognitive, and social activity that may protect older adults from cognitive decline. So here is a model of how volunteering leads to functional improvements and decreases dementia risk among older adults. So unlike a lot of activities, volunteering has an added value because people typically volunteer to help other individuals. Volunteering has a altruistic component that is not inherent in other lifestyle activities, and there is some evidence that performing altruistic acts is related to better physical and mental health in seniors, which through biological and psychological mechanisms leads to improving functioning associated with reduced dementia risk. Now, life has changed a lot with COVID-19, making it a bit more difficult or a bit more challenging to participate in activities that we usually enjoy. Nahid, has COVID-19 affected cognitive decline in any way?
Oh yeah, that's a good question. Yes, it has. There is an impact of COVID-19 on cognitive decline. And there are direct causes and some indirect causes. So some of the more direct causes are as a result of the virus itself that can get into the brain and making a long story short, can essentially wreak havoc or can damage some brain cells. But also COVID itself has a propensity to increase blood clots. And so that also includes potentially getting strokes, which people have been getting when they do get COVID. COVID also, if it impacts the lungs, can reduce oxygen delivery to the brain, and the brain depends on that for survival. So that can impact brain cells, and you can have decline of cognition as a result. Some of it can be transient, and some people recover, but others don't. And then indirectly, we spoke about the endocrine system and the immune system, right? Again, these things keep coming up over and over as some of the root causes of chronic disease and things like dementia. Well, COVID-19 or SARS-CoV-2, the virus, is a stressor that stimulates these things in a very not normal way. And that in turn, through several different routes, can also cause memory decline and dementia. And I think the key here again also is at any age, whatever age you're at, do the types of things that ensure that your endocrine system and your inflammatory system are kept in check. So exercising, meditation, eating well, volunteering. Yeah. One last point actually, those with dementia, if you know anybody who has dementia or yourself has dementia, that increases the risk of getting COVID-19 and also increases the severity of COVID-19. So protect those who have dementia against it by following the public health guidelines with distancing and so on, but also acquiring the vaccine. So if you've already received your vaccine, that's good. The second one, I think there's a second one that should be coming down the road, so keep an eye out for that. So ensure that you're registered if you're qualified. And if you haven't already, please do consider getting one as a preventative measure. Let's move on to the next slide.
It's that time again. Nahi, don't go anywhere. It's your turn.
All right.
All right, so everybody, we get ready for brain challenge number 2. Nahid, I would like you to say the months of the year in alphabetical order.
All right, let's do this. Okay. So we have August. No, wait. We have April, August, December, February, March, May. No, wait. January, November, October. I don't know how.
No, you did so well. You did so well,
Okay,
Nahid. That was so good. Thank you so much for participating. So this brain challenge can be further enhanced by trying to do this activity in reverse alphabetical order. So thank you again, and I hope you all played along at home. So there is still one more brain challenge coming up, but first I will continue our discussion on neurocognition and cognitive decline with dementia. So dementia is not a normal or inevitable part of aging. As we age, our brains change, and it's normal to occasionally forget recent events, such as where you put your keys or the name of the person you just met. People with dementia have symptoms of cognitive decline that affects more than one aspect of function, including memory, language, behavior, ability to work, manage finances, medications, and driving, and can be severe enough to affect everyday life. The term dementia is not a specific disease, but an umbrella term for several diseases affecting memory, other cognitive abilities, and behavior. Dementia is an abnormal degeneration of the brain that leads to changes in a person's ability to think, speak, socialize, and take part in normal daily activities that cannot be explained by an active primary psychiatric issue or other reversible causes. And now, Nahid, in the next slide, we'll discuss the difference between dementia and mild cognitive impairment.
Yeah, so mild cognitive impairment is a term that is used out there, and it means something, but it does not mean dementia. So what is it? Well, it means that somebody may have trouble with what we call the domains of cognition, or so may have difficulty with memory, like Nadia talked about, forgetting the keys or forgetting perhaps the date of something new that they've learned, some difficulty finding the right words. But all in all, none of this impacts their ability to function in a normal way. It doesn't impact them with the ability to work, drive, manage their finances, and so on. Now, having said that, if this difficulty with sort of remembering things is new, it may put them at a bit of a risk of progressing towards dementia. So it's best to, on a yearly basis, just keep an eye out and see if it does that or not. Most people don't progress that way. So that's reassuring. But just to be prudent, it may not be a bad idea just to see if they're starting to have some difficulties with some of their functioning, and not to attribute it to just aging. And so, again, in a nutshell, dementia then is difficulty with those domains, with memory, ability, trying to make decisions and plans, but ultimately, which lead to difficulty with day-to-day functioning. So that's the most important part. All right. And as Nadia already mentioned, there are many things that can cause dementia. And as she also mentioned, numeric age, or being 60 or 80 or so on, perhaps is a risk, but it's not a cause. And there are some young individuals with dementia, and there are many older without dementia. What causes dementia? So essentially anything that causes damage to brain cells, which leads to decline in functioning. You need your brain cells to be able to do a lot of functions in life. And the brain cells can be quite unforgiving. So if you have brain damage and enough of damage to brain cells, it could lead to loss of function, which is irreversible. So let's look at the kinds of things that can lead to damage of brain cells. Trauma, whether it's one big trauma or repeated trauma to the head over time. Stroke, tumors, alcohol, whether it's chronic, decades and decades of use, or substance abuse, like drugs, narcotics, and so on, over time can do that. Abnormal proteins that can be formed by what we call, what we're more familiar with, like Alzheimer's, where you have, amyloid and tau proteins, other proteins from Parkinson's disease, and frontotemporal dementia. And these essentially, if you look at the picture below, some of these proteins can get into the brain cells and then eventually cause problems inside the brain cells, and the brain cells start dying. So you have what's visible is quite a bit of shrinking. And on a picture beside that is an example of a brain that's had a large stroke, and where you see a lot of black inside the brain there, that's brain tissue that's died. Okay. Other things that can also cause it too, like chronic psychiatric illnesses, such as post-traumatic stress disorder. Infections can cause it, nutritional deficiencies over a long period of time. And then we have this emerging concept called digital dementia, which we're slowly starting to learn about, where you have an overuse of technology, overuse of cell phones, overuse of video games. And it can put a brain in a certain environment that may cause it stress and start to perhaps die prematurely. So it's an emerging concept and one to look out for in the years to come. All right, so moving on to the next slide. So not only is dementia caused by a variety of things, and not only can it occur really at any age, with a higher risk as you get older, but what we're finding is that there is an interesting association in dementia and women. And women tend to have disproportionately higher prevalence or existence with dementia in society. So there are many varying studies, but roughly 2/3 of those with dementia tend to be women. And if you look at the graphs on the right, if you look at the, if you follow the blue line on the right, whether it's any dementia of any cause that we talked about, women tend to have a higher incidence of it, and then eventually prevalence. And specifically looking at Alzheimer's, which is the most common form of dementia, women again have a higher incidence rate. So women are living more with dementia. We don't necessarily know why that's the case, and there's many theories out there as to why women tend to have a little bit more dementia than men in society, but we do have some clues. So for example, women have a 2 to 3 times higher risk of developing something called post-traumatic stress disorder, or PTSD. And PTSD itself carries a twofold higher risk of developing dementia. PTSD is a psychiatric condition where individuals are faced with trauma, whether it's psychological, physical, emotional, anything from car accidents to abuse to some sort of environmental catastrophe. And while some people recover from such a thing, people with PTSD don't recover. And some can have months to years and decades, perhaps even a lifetime, of continued anxiety, depression, and moments of reliving their initial trauma. Now, in addition to also having a higher risk of having dementia, women also are disproportionately higher in terms of providing care to those with dementia. So there's generally a higher portion of women who care for patients with dementia and chronic disease that are like wives and daughters and so on. And there are a high portion of those who are in their professional capacity who provide care with those with dementia and other diseases in the hospitals, community setting, and care homes. And this has implications to both women within the household and in society. In many cultures, women tend to be the cornerstone of their family unit. So you can imagine that if they are Caregivers, they may face caregiver burden or burnout and stress, and that may perhaps impact their careers and their own self-care. If women tend to be those who get afflicted with dementia, and they're the cornerstones of the family, then you can imagine what that does to a family unit. And then in society overall, if many women tend to have strain or burnout due to being caregivers or themselves have dementia, then you can only imagine what that does to the fabric of society. And that's something to think about. So moving forward, and Nadia, would you be able to tell us some of the symptoms and signs to look out for?
Sure. So dementia develops at different rates in different people, and the early signs of dementia can be very subtle and vague and may not be immediately obvious. So these could include cognitive changes, so memory loss, confusion, disorientation. And in the earlier stages of dementia, memory loss and confusion can be mild. The person with dementia may be aware of or even frustrated by the changes taking place, such as difficulty recalling recent events, making decisions, or processing what was said by others. In the later stages, memory loss becomes far more severe. A person may not recognize family members, they may forget relationships or call family members by other names, or become confused about the location of home or the passage of time, and may forget the purpose of common items. Signs can also include psychological changes, in which case individuals living with dementia may also experience mood and personality changes and can become confused, suspicious, depressed, fearful, or anxious, and may be easily upset at home, with friends, or when they're outside of their comfort zone. So moving forward to the next slide, it's important to note that in many cases, these signs and symptoms can go on without being noticed, and people may fail to recognize that these symptoms indicate that something is wrong, and may mistakenly assume that such behavior is a normal part of the aging process. Sometimes even the decline in cognitive functioning is also mistakenly attributed to physical limitations, so the use of a walker or cane. And for example, requiring a walker due to reduced balance and strength may explain why someone may need help bathing, but not why they also have difficulty booking their own doctor appointments and managing their medications. People may also refuse to act even when they intrinsically know something is wrong. It is very important to understand these symptoms and seek medical guidance from your healthcare providers, and also consider requesting a referral to a specialist who has experience in cognitive decline if you notice yourself or a loved one experiencing these symptoms. And in the next slide, we see that at this time, there is no treatment available to cure dementia or to alter its progressive course. Symptoms can, however, be managed through a combination of medication, non-drug therapies, and lifestyle changes. Supports that improve the lives of people with dementia, as well as their caregivers and families, are also available and should be utilized, that offer financial help, caregiving support, emotional support, and general educational resources. And I will also share that list of supports and available resources nationally at the end of this presentation. And now it looks like it's time for the third and last brain challenge. So here is a list of 4 words. Nahid and Shaheen, I want you all to study these words. And at the end of the presentation, I will ask you to recall as many as you can remember in any order. So these words are green, crossword, flower, and chair. So that's green, crossword, flower, and chair. So I hope you guys all got those words, everybody at home, and I'll ask you at the end of the presentation to recall them. All right, so I will now hand it over to Nahid, who will discuss the strategies based on severity of dementia.
Thank you. Yeah, Nadia mentioned that sometimes it's difficult for people to have discussions around dementia because it is quite sensitive. I would say it's probably much easier to talk about things like diabetes and heart issues than is with dementia. So the other thing to recognize with it is that there are different severities of it. So sometimes people think about dementia, they often go right to the very end and think about the worst. But there are stages of it, and different things can be done at different stages. So at sort of the mild and early stages, people might have some difficulties traveling to new locations or even some less used locations. And that's, again, a new symptom. They might have difficulties handling problems at work. And I've seen individuals who are professionals like surgeons, lawyers, uh, CEOs or business owners who, um, while working, have developed dementia, and usually they're a bit younger, so usually it's more of the frontotemporal kind, for example, but it can be quite impacting to them. And the key there is to to look out and make sure that there's no other medical issues that might be causing it, like thyroid related issues. But then also recognizing that this is dementia, and you'd be surprised how many don't. It doesn't even occur to them that this could be it. And so, unfortunately, people have to suffer through this before getting a diagnosis. In other stages, people can have difficulty with driving, and again, it's in itself a sensitive discussion, but one that ought to be had if there are difficulties that are emerging with driving. Um, in sort of the more moderate stages, people may have difficulties with managing complex tasks like complex finances, medications, and booking their doctor's appointments. They may have difficulty getting plans going to actually execute a plan. They might know what they want to do, but they might have difficulty with getting it going. And often then people might attribute that to being lazy or depressed or just not being motivated. And that alone can cause strain in the family. But the key here is to have a structured environment, to plan activities for the day and for the week, and to have cues available to help people in this situation be able to be as independent as possible and to have a meaningful life. But dementia is progressive, and there comes a time where people not only have a difficulty learning new things, but then they will also unlearn things that they've already have learned before. So they may have difficulty clothing, bathing themselves. And in this situation, all the other things that we've talked about, exercise and developing structures, might be a challenge. So in this situation, they might need more supports. You may have to have another difficult discussion of perhaps being, in a lodge or an assisted living to minimize caregiver strain and to provide the best sort of environment for them to thrive in. And then beyond function in dementia, some people end up having no ability to function meaningfully anymore, but there still needs to be a meaningful existence. So in these settings, it's important to look at their dignity and say what's best for them. It's important to look at and have discussions like goals of care, palliation, palliative care, and so on. So there's lots that can be done, but this is sort of just an essence of, seeing or appreciating that there are severities to dementia and different things can be done at different levels. Now, in addition to severity, people can have different behavioral changes. And I think now they can speak a little bit about that.
Yes, so there are many non-drug approaches to manage behavior symptoms and promote physical and emotional comfort. Many of these strategies aim to identify and address the needs that the person with dementia may have difficulty expressing as the disease progresses and can be used at home and at assisted living facilities. The first is social contact, and that includes pet therapy, which promotes socialization, emotional support, and sensory stimulation, and one-on-one visits. So these one-on-one visits, if it is safe to do so following COVID-19 restrictions, can provide an opportunity to chat or read, plan new activities, or perform daily tasks together. During the pandemic, with the restrictions on one-on-one visits, I have also seen the growing use of technology as an option to maintain social contact and support for people with dementia via video platforms like Zoom. Next, we have sensory enhancements and relaxation strategies, which include massages, individualized music, art, sensory modulation, and multisensory environments like snoozling. which all focus on sensory stimulation. So snoozling therapy is actually a strategy I use while working in a care home, and it consists of placing a person in a soothing and stimulating environment that is designed to deliver stimuli to various senses, so lighting effects, color, sound, music, and scents. So it's a very cool, very interesting therapy. And I also wanted to speak a little bit about music interventions and how they are used to engage individuals, create familiarity, and reduce anxiety. So, incorporating personalized music preferences into daily care and activities can help maintain a person's quality of life and provide a way to connect even after verbal communication becomes difficult. And I've seen this with my work as well. Playing music for a resident from their childhood or a special time in their life and watching their reaction, and even in the later stages of dementia, can be such a positive experience. It can change a person's mood and behaviors. Next, we have purposeful activities, which is the engagement in helping tasks and volunteer roles and being included in group activity programs. So, overall, activities that help an individual feel like they're a valued part of the household or care home, like setting the table or other tailored activities, can provide a sense of success, purpose, and accomplishment, while also providing an opportunity for self expression and self determination. Physical activity could include activities such as outdoor walks and group exercises. And neurocognitive intervention technology would be the use of technology like tablets, computers, or gaming consoles, which is a great way to engage and socially interact, especially during the COVID-19 pandemic, where we have seen a lot of new technology based interventions. Lastly, caregiver interventions, which include caregiver education and support, which can help provide caregivers with guidance to understand the disease better, to solve practical problems related to care, and could include strategies to manage behavior symptoms and help figure out what the underlying causes are of certain behaviors. Sometimes these behaviors are caused by unmet needs that a loved one is unable to communicate, like fatigue, physical discomfort, or fear. So those are some of the non-drug approaches. And Nahi, can you explain a little bit about the common disease management strategies?
Or, yeah, I was going to say, thank goodness you haven't used the word snuzzling in any of the previous brain challenges. I don't know if it's going to be coming up next, but well, yeah, quite the word.
It is
Anyway,
good.
yeah. So yeah, some of the common disease management strategies to date, you may have heard about cholinesterase inhibitor. One of the more common ones is Aricept or donepezil, and it's often used in Alzheimer's disease, dementia, and Parkinson's disease to potentially slow down the process of memory decline, and sometimes in behaviors that may emerge, like anxiety and so on. Um, but this medication does not create new brain cells, nor does it slow down the breakdown of brain cells. So it's not what we call a disease modifying agent. There are many studies, ongoing studies looking at those. So maybe, who knows? I mean, if we're optimistic, maybe in 5, 10 years, but don't quote me on this. But we have to be optimistic. Other things, we talked about stroke being a contributing factor to dementia. So stroke preventative strategies are important. So if somebody has atrial fibrillation, it's important to consider an oral anticoagulant to keep their blood thin. And atrial fibrillation, you can develop blood clots in your heart. Those clots can dislodge and you can get stroke as a result. I mention this because many studies show that people often also as they age are undertreated for atrial fibrillation. It's also important to manage other contributing factors such as hypertension, dyslipidemia, diabetes, smoking, weight management, and so on. And Shaheen has done a great webinar series specifically on these topics, and one titled Heart Health, Women's Heart Health, A Journey Across the Lifespan. So you can see more in detail about management of these risk factors on that webinar. And then we can do things we can have medications for specific behavioral changes. So if somebody has depression as a result of dementia, we have medications to help with that symptom. For psychosis, for example, if people are making up stories, we call those delusions, or if they're seeing things that are not there, or if they're becoming agitated, we have medication strategies to help with that. Um, for difficulties with sleep, anxiety, and apathy, so low motivation, etc., we also have drug strategies for that. And it's important to have both the non-pharmacological strategies that Nadia talked about and, where indicated, medication strategies to help manage with some of those symptoms. So moving forward, um, I think all this talk about dementia and frailty sometimes can dampen the spirit, but it doesn't have to be this way. One can still remain happy in spite of erosion or loss of their physical or cognitive abilities. And to stay happy, I think it's important to anchor your happiness to your spirit. I came across this, or at least within Arta Rica, it's a concept that's always there, but uh, it sort of dawned on me a little more of this concept dawned on me a bit more. Earlier on in my career, when I had a patient who had Parkinson's disease, which again impacts both the cognition and physical abilities. And in some ways, he was spiritual. He was a good family man. He did lots of things for his community, um, and he also meditated, which is very interesting, actually. But over the years, he was losing his ability to do things physically and cognitively, but he stayed happy, and his family said he was always happy. And when I asked him, I said, what's keeping you happy? How are you managing to still be happy? And he said that he saw the shutting down of his cognition and physical abilities as a way of the universe telling him to focus inward, to look to the world within. And that's what he had been doing. So that's a story that I've really kept with me throughout the years. Um, Now, for those of us, or for those of you who have the good fortune at this point to have good reserves and resiliency with their cognition and physical abilities, continue to build on those reserves and resilience. Continue to build on that true age, especially when times are good. Because, as a good colleague of mine, Dr. Damien Patton Gay, who's a trauma surgeon and intensive care specialist, says, train for the medical challenge that will come. Yeah. All right, so moving on to the next slide. Nadia, can you tell us a bit more about the impact to caregivers?
Yes, yes. So caring for a family member with dementia can be challenging and at times can be overwhelming. Caregivers provide care to people who need some degree of ongoing assistance with everyday tasks or on a regular or daily basis. But this role can also put caregivers in physical, emotional, and financial pressures that can cause stress or burnout. Caring for a person with dementia can also seem like a series of grief experiences as you watch your loved one's memories disappear and skills change. Caring for a loved one with dementia who is changing and behaving in different ways can sometimes be upsetting and produce an emotional clash of confusion, frustration, sadness for the caregiver. And these are normal and valid emotional responses. And what I really want to stress here is that caregivers are not alone. There are many effective supports available to those caring for people with dementia that help caregivers as they manage care, reduce stress, improve coping, and reduce the financial burden. I also wanted to stress here that caregiving can be a very rewarding experience. I know families that have grown closer after a diagnosis of dementia and look at the caregiving role as an opportunity to spend time with a much loved family member who needs support and care. This experience can open up bonding opportunities as well as a chance to share stories, get to know each other better, and create new memories. Nahid, can you tell us a little bit about how people diagnosed with dementia and caregivers can make decisions about things like finances and health and welfare and overall capacity?
Yeah, so that's a very good question. So, people with dementia, and sometimes without dementia, which we'll talk about a bit more, at some point in their life may come across a situation where they have an inability to make decisions that are informative and insightful. So the ability to make those types of decisions is what we call capacity. And when we look at capacity or the ability to make decisions, we sort of see it in the domains or the areas of personal health, accommodation, legal matters, and finances. Those are sort of the big areas where all of us have to think about. Maybe we probably take for granted, but certainly those are the areas that many of us have to think about when we make decisions of our life. Now, having dementia does not automatically mean that there is no capacity or ability to make decisions. In fact, in some of the earlier stages, it's not even a concern at all. But inevitably, some will get there. The other point then is also that making a bad decision also does not mean that there's lack of capacity. People make questionable decisions all the time. We see that in our line of work. But you're allowed to do that in life. So when we see people in a situation where there's been a series of questionable decisions, and particularly those who may have a reason to, may have dementia, for example, what we do is we may see a trigger for something called the capacity assessment, where we ask the question, are they making just bad decisions that some people can make, or are they making decisions that are not informative and insightful, i.e., are they making it, do they have a lack of capacity? So now on the same note, moving on to the next slide, all adults should consider having something called a personal directive and a power of attorney done while they still have capacity. So I've seen young individuals, middle-aged, and older individuals who've lost capacity for various reasons, and often it's not predictable. So it's important to get a personal directive and power of attorney. A personal directive is a document that comes from, it's a document that allows one to say, this is what I want done for me in the event that my heart were to stop, or in the event that I have a difficult time breathing. I want these things done, or I don't want these things done. It also says that in the event that I'm not able to make decisions while I'm still alive, I want so-and-so to make those decisions on my behalf. A power of attorney is similar, but it does it in the area of finances. A personal directive does it in the area of accommodations, health, and legal matters. Now, having said that, it's important to, I would say, get a good lawyer to help you in this area, or at least lawyers who are well-versed in this area. Estate lawyers are lawyers who are well-versed in this area, for example. And the reason why I mention this is most times when we see these situations, they can be very straightforward to manage, but we see a good handful of situations where the situation the patient and families are quite complex. And that can mean that if a problem isn't solved in a timeful way, then the patient is often just suffering due to their medical condition or having to wait a long time in the hospital or elsewhere while situations get figured out. So make sure you get a good lawyer to have good paperwork in place. All right. So this takes us to our take-home messages. I think we've touched upon a variety of things today. But I want to start off with the first take-home message with the brain challenges. They are quite fun. And I think some people might be wondering, goodness, if I didn't get it right, is there something wrong with my memory? That's absolutely not the case. If you look at the challenge that I went through and Shaheen, and I'm not sure who was the best between the three of us. I'm just kidding, Shaheen saw it. You can see that we both sort of struggled in all these areas. So the rule number one, yes, this was only supposed to be something that's fun. It was supposed to make you think about brain health. It does borrow from some screening tests, but it's not diagnostic. And certainly we're not in an environment where you would use this in a diagnostic setting. So be cognizant of our brain health. Make sure you stretch your brain, challenge your brain at all times. because even in older age, brain cells still have plasticity or the ability to create new connections. And so, whether you're doing puzzles or encouraging yourself to take on new activities that you hadn't thought about, like learning how to play a new instrument or taking a different route to work, something that stimulates your brain is actually very healthy for your brain. So, keep doing that. Nadia, what else can we do?
Um, just to move on from our other take-home messages, healthy aging of the brain, body, and spirit are all intertwined. Dedicated lifestyle changes can add greatly towards healthy aging and prevention of frailty and dementia. And that includes changes in physical activity and eating healthy, for example. And the sooner we make those changes, the better. Dementia may or has many contributing factors and causes with varying severity and symptoms, and it is important to take note of those symptoms and seek medical guidance from your family physician and healthcare providers, and request a referral to a specialist if you notice yourself or a loved one experiencing any of these symptoms. There is a higher risk of developing dementia in women and versus men, and there are various drug and non-drug strategies to manage these symptoms.
And to date, there are no drug treatments available to reverse or slow down brain cell loss once you have dementia. But there is research being done to look into them. It's also important to note that in the event that you may lose the ability to have the ability to make decisions, or a loved one who may get there, it's important while they still have capacity, or while you still have capacity, to obtain a personal directive and power of attorney. And lastly, I think the most important point in all of this is that you can still be happy despite the erosion of your physical frailty or cognitive reserves, or if you have dementia. You shouldn't, at least I would say, from the good stories that I've seen in practice, those that are happy haven't anchored their happiness to their physical or cognitive abilities. Those tend to be fickle. So,
We have shared a few websites here that can provide educational resources, caregiver support, and more information about planning for the future and advanced care planning. Direct access to these resources are also available on the II Canada event page for this webinar. We spoke a lot today about workouts for your brain, so check out your local dollar store or online stores for activities that can challenge you, like crossword puzzles, Sudoku puzzles, and word searches. These can always be fun ways to keep your brain active and have fun. On the next slide, we have also included some recommended reading. So that includes books you may be interested in reading that touch on the dementia journey and the practical advice for those caring for loved ones with dementia. And now it's time for the end of our brain challenge number 3. So for those of you at home, and I'm going to call upon Shaheen for this one.
I get the short straw today. What's happening?
I want you, if you could recall the 4 words I mentioned before.
Okay, actually, honestly, I didn't find this one as difficult as brain challenge number 1, because I made a sentence.
Oh, that's good.
So, there's a green flower and a crossword on the chair.
Perfect.
Right? So the 4, it wasn't hard. So it's good. Thank you. Thank you.
That's great. Thank you so much. And I hope everybody participated at home. Thank you all.
All right. Well, thank you so much. That's a great segue into our multiple choice question then. So remember, everybody, let's go through this again. Just one of these 5 statements is correct. So let's quickly go through them. Which one of the following statements is true? Aging means you have poor health and or disability. And my brain can hear some of you guys talking here. No, it's false, of course, right? Memory loss as we age always results in the inability to function. This is, again, another false statement. There's nothing a person can do to reduce the risk of dementia. I'm sure you all know that's false. Healthy aging practices are only for those who are in their 60s and older. False. All right. So now if you use your intellect, you have to decipher that, hey, this last one has to be correct, right? So people can still live well with a diagnosis of dementia. So that is absolutely true. Well, all right. That's been a lot of fun. And this brings us to the end of our webinar today. And what an eloquent presentation that it has been by our experts. It's just been fantastic. So thank you to Nadia Tajdin and Dr. Nahid Rajbali for sharing your knowledge, your experiences, and your time. We really appreciate it. And to our attendees, I hope you learned a few things about our mind and healthy aging and how to reduce the risk of intellectual or cognitive decline. Take care, everybody. Stay safe. Until next time, Khuda Hafiz.